I'm not ashamed to say there were times where I felt like I wanted to end my life. I wanted to terminate the pregnancy, and it wasn't that I wanted to get rid of my son, it's just that I wanted to get rid of the sickness. I had to put towels under the door because I didn't want the smell of him coming into the room, and had to have all the windows open. Yeah, it was really extreme, and I thought, this just doesn't feel right. Something's not right here. I was just sitting in the bed thinking, I don't want to tell James, but I'm really scared, and I don't know, I just can't be a mother to my son. I just feel like I'm not good enough.
Welcome to another episode of Everything Changed. Today I am joined by Carly. Thank you so much for coming on. When you messaged me to come onto the podcast, I was really sad to hear what you've been through. For anybody that doesn't know you, can you explain, what it is that you've been through?
Yeah, sure. So I got married in 2021, I had to think about that then, to my husband James, and then a month later I fell pregnant. It was all a bit of a whirlwind, but we were really excited because we did want to have children at some point.
Yeah,
I was really excited. Obviously, when it's the first few weeks of pregnancy, most people don't want to share it because it's quite early days, there's a lot of risks involved. And then in the back of my mind, I was always a bit worried because my mum and my nan had a condition called HG when they were pregnant. And my mum always said to me, I worry about you getting pregnant because you might inherit this condition that your nan and I had. And I just thought, no, I'll be fine. I'll be fine. It won't affect me. And I got to about week 4, week 5 of pregnancy, and I thought, everything's going great. I don't feel sick. All's good. And then it was this time in 2021, literally this week.
Oh, really?
It was like week 6, and everything changed like within the flick of a switch. I couldn't get out of bed. I felt really dizzy, really sick. But I just thought, this must be normal. Every woman that I've spoken to has what they call it morning sickness. Yeah. So I thought, I've just got morning sickness. It won't last very long. I'll be fine.
So were you being physically sick, or you just felt really nauseous?
To begin with, it was just extreme nausea.
Okay.
And I thought, this will go. This is just a phase. And then I think by halfway through week 6, I started to be sick. And by the end of week 6, I was going from being sick once a day to being sick about 10 times a day.
Wow. This episode is sponsored by RevitaLash Cosmetics, a revolutionary beauty brand founded by Dr Michael Brinkenhoff, who created the first eyelash serum to help his wife Gail feel more beautiful during her battle with breast cancer. RevitaLash Advanced Serum truly works, and I continue to use RevitaLash Advanced myself. And not only that, but a portion of every purchase goes towards global breast cancer research, including studies at the Francis Crick Institute in London. And did you go to the doctors at this point?
So actually what happened was I didn't go back to work. I told them I had a sick bug. It kept happening. I was sick every day for about 10 times. I couldn't get out of bed. And then I started to notice that I couldn't smell, like my sense of smell was off. Like I either couldn't smell anything or my senses were really extreme. And I thought, something's not right here. Like James, my husband, would come into the room and I couldn't even stand the smell of him.
God.
And I had to put towels under the door because I didn't want the smell of him coming into the room, and I had to have all the windows open. Yeah, it was really extreme. And I thought, this just doesn't feel right. Something's not right here. Then halfway through the 7th week, I was vomiting that much and I couldn't get out of bed that I thought, right, I need to speak to the GP because I need some help. A few of my friends told me, you can get anti-sickness medication. So call the doctor and see if they can help. Before I managed to get to the doctors, I was so dehydrated from being sick and I couldn't eat anything. I couldn't drink anything. Even having sips of water made me vomit, that I ended up going to A&E because I was so dehydrated. When I got to A&E, they tested my urine, and I think with the condition that I was diagnosed with later on down the line. You can't. That's not. It's not an accurate way of diagnosing whether a pregnant woman's dehydrated or not. So they basically said to me that you are dehydrated, but it's not an emergency, but we'll give you some anti-sickness anyway and some fluids.
Right.
And I felt so much better after having them. And then I got home, and within 48 hours, I was back to vomiting 10 times a day again. It's horrendous.
You must have really been worried about the baby as well, I guess, being so dehydrated. And were you losing weight? Because
I was losing weight. I was in bed. Well, altogether, I was in bed for about 4 months.
So
I didn't even go downstairs.
Back to work.
I didn't go back to work. I was vomiting so much. Yeah. I was signed off. Thankfully, I was very fortunate. A lot of women who had my condition weren't. I went to the doctors after I'd been admitted to hospital, and the GP I saw was a female GP, and she said to me, "You've got a condition called HG, which stands for hyperemesis gravidarum," which sounds a bit like Harry Potter spell. And I was like, "What is this? Harry what?" She said, "You've got HG," and I had it in pregnancy. It's a really horrible condition, and there is help. You can get medication if you need it. I was really fortunate that when I went to the hospital, they sent me home with like a second line anti-sickness, which most women don't have access to. And the GP was able to prescribe it to me. But I know for a lot of women who have HG, getting medication is a battle, is a real battle. And getting the treatment that they need, because it's not fully understood in the healthcare profession. And there's a lot of charities out there that are fighting to get to do more research, to share their knowledge of HG with medical professionals so that the women with HG can get better care. But it's like an ongoing fight. And
being at home pregnant, I guess you weren't enjoying your pregnancy at all, were you? And you know, how did that impact your mental health? Because I think when it's your first pregnancy, sometimes you're excited, and I don't know, there's a lot of comparison on social media and things about, you know, when you're pregnant. How were you feeling?
Well, before I started being sick, I was really excited, and I was doing all of the things that a lot of first-time pregnant women would do, like look online at baby clothes and think about maybe having a pregnancy photo shoot or go into like pregnancy yoga, all of those things. But then when the sickness started and I was told that I had HG and I needed anti-sickness medication, and I was in bed and I couldn't stand the smell of James, I just thought, this is just awful.
Were you just awful. Counting down the months?
I was counting down the months, but there were so many things which I want to talk about that helped me along the way. But I have to say that overall, I really struggled mentally, because my life changed completely. Like, I was a very busy person. I had like 2 jobs in the profession that I trained in, and I was also dog walking. So I was really active, and I went from that to just sitting in bed. And because HG is not very well known unless you've had it or you know people that have had it, my friends and family, they did their best to support me, but in the beginning they didn't really fully understand. And then they were saying things that they thought might be helpful, like, "Oh, it's nice to just be able to lie in bed though, isn't it, and relax." And I thought, I can't even lift my head off the pillow, and when I do, it's into the sick bowl next to my bed.
When your son was born, was that an instant relief? Did the sickness stop? Did it continue the whole way into the end of your pregnancy?
Unfortunately for me, it started at week 6, and then I had a planned caesarean section at 38 weeks and 5 days. Funny how I remember exactly, because I was counting down the weeks and days until I was hoping that I wouldn't feel sick. Some women, unfortunately, with HG, they do still get the symptoms after, but fortunately I didn't.
So instantly the sickness stopped?
Instantly it stopped as soon as he was born, but then more things happened after that.
And what happened?
So I had the planned caesarean section. I remember them pulling him out of me, and I felt emotional when I saw him. And then it was a bit of a blur, but after that, in the recovery room, I remember holding in my arms and feeling like I can't bond with my son, and I felt terrified of holding him. And I just thought, because I thought when I was pregnant that after the pregnancy everything would just be lightness and joy and perfect. I think because it was so extreme when I was pregnant, mentally and physically. When I gave birth, I thought it would just be wonderful. And you know, it was a shock because it was hard, and you don't get any sleep, do you, when they're first here? They need feeding through the night, and it's a lot. And if you've had a C-section as well, it's like you've got to recover from that. And I was also trying to recover from just being so physically sick and unwell. I guess you're
weak.
I was really weak, and I just felt like I can't do this. I'm petrified. I'm petrified of making the wrong move. I'm scared to get to know my son. It just all felt too much. And it was heartbreaking because there was a massive part of me that wanted to bond with him, obviously, and wanted to care for him, but I just kept passing him back to James because I just felt so severely anxious, like I can't do this. I just can't do it. That was the thought that came to my head, and at the time I couldn't understand why I couldn't do it. I just felt terrified.
And I guess your background, you're a therapist. You have the tools and, you know, to get yourself through hopefully a situation like this, but it's not that easy.
It's not that easy. I think it's easy to, you know, dish out the support and advice and guidance for your clients, but then when it comes to yourself, it's so different. And
I think also, sorry to interrupt you, but I think with things that are postpartum as well, it can be like hormone imbalances, can't it? So it's not even really within your control.
Yeah, absolutely.
So sometimes it's harder. But is it true that women that go through HG, is that the short term? HG, they are more likely to suffer from postnatal depression?
Yes.
Were you aware of that before?
I was, yeah. I was very fortunate in my pregnancy. There was a lot of, because I'm a therapist, I think naturally I have that ability to reach out and ask for support. I know a lot of women don't, and that's partly why I'm coming onto this podcast, because I want to spread awareness and just share the message that it's okay to reach out for help, and there is a lot of amazing help available. So when I was pregnant, I reached out to a charity called Pregnancy Sickness Support, PSS for short, and they have mentors who have had HG who can support you throughout your pregnancy. So I had this amazing mentor called Sarah, who I just want to mention because she saved my life. And I don't mean that I mean that in a literal way, because I felt suicidal when I was pregnant.
When you were pregnant?
When I was pregnant, yeah.
Did you?
I felt suicidal, and she signposted me to mental health services that I could access whilst I was pregnant. And if it wasn't for her guiding me, she literally messaged me every day, Rosie, when I was pregnant, to say, you can do this, you can keep going. Because I'm not ashamed to say there were times where I felt like I wanted to end my life, I wanted to terminate the pregnancy, and it wasn't that I wanted to get rid of my son, it's just that I wanted to get rid of the sickness and the ill feeling. But she helped me and supported me to reach out to my GP. And cutting a long story short, I was referred to a perinatal mental health service, and they supported me for the last 5 months of my pregnancy. And I was taken from like a community midwife to a specialised mental health midwife who was amazing.
And this was once he was born?
This was whilst I was pregnant.
Oh, while you were pregnant.
Yeah, and then it was like a continuity of care then, which was amazing, from when I was pregnant up until after he was born, where things changed again when I was back home. So when I got back home, I was in hospital for about 48 hours. I was terrified. I kept handing my son to James and asking him to change his nappy and feed him. And I was just sitting in the bed thinking, I don't want to tell James, but I'm really scared, and I don't know. I just can't be a mother to my son. I just feel like I'm not good enough. It's really hard talking about it now, actually, because I feel like I can offer myself kindness now, but at the time I couldn't.
Yeah.
I was really cruel to myself.
I was really shocked when you reached out to me, because you seem like, well, you are an amazing mum, that you had this self-doubt is, just really sad to hear. I think it's so hard when you first become a mum anyway, or a parent. It does change your life significantly. But I think when you've had something traumatic happen in the lead up or during your pregnancy, it can really affect you mentally.
Yeah, absolutely. When I got back from the hospital, I suppose I didn't really share with many people because I felt ashamed. Only like close friends knew. So my friend, she texted me saying, "How are you doing?" And I remember messaging her back saying, "I feel like I'm in a nightmare that I'm never going to wake up from, and I just want to go to sleep and for it to all go away," basically. And she was like, "I need to come and see you." So she came and saw me, and we spoke a bit more, and I was still under the community mental health team at that point. And she suggested that I reach out to them and let them know that I was still struggling. And I don't think I would have, actually, if it wasn't for her kind of pushing me and saying, "Things are not right, you deserve to have some support with this." And then another friend came round, bless her, and she's the total opposite of that friend. She's not the kind of friend that maybe you would go to or speak to about the more emotional things. She was like the practical friend. She came round with 2 massive bags of milk, and she was like, "Right, come on, let's get you sorted." But both of them in their different ways really helped me. Like, I needed that emotional advice and I needed that practical advice.
It's amazing that you actually opened up to your friends and told them how you were feeling.
I was really scared to do it. Even though I'm really close to them both and I know that they would never judge me, I wasn't in that frame of mind at the time. Like you say, hormones can play a massive part anyway. They talk about the baby blues, don't they?
And everyone, there's just this prejudgment about being like the perfect mum and having it all together, and you see other people and you're like, how are they looking so amazing and doing this? And so
it's not like that at all. And I imagine if you speak to mums and actually say, "How are you actually doing though?" I imagine most mums would say, "I'm struggling a bit with something."
And you don't know what's kind of normal and what's not, because I think you're sleep deprived, and I think it's really normal to have like intrusive thoughts and think weird things when you first had a baby, like, what if I squash them? What if I don't hear them? What if I drop them? You know, like, I remember I was so tired. I was like hallucinating. But you think about all of these like things that are probably not going to happen, but those thoughts get inside your head.
They do. I remember going in the shower and thinking I could hear him cry, so I ran out the shower like naked along the hallway, dripping wet, and he was fine. He was with James.
I do. I think it is normal, but I think trauma and stuff kind of highlights that. So once you guys were both home, what did the following weeks look like after you'd spoken to your friends?
So my friends, they said, "Right, you need to get some more help. I can see that you're struggling to bond with your son." And I just thought, right, I'm going to have to speak to somebody, because even though I didn't feel like I could bond with my son, I wanted to. So that was like, I thought, right, there's hope. There's hope here, because I want to, even though I'm struggling. So I reached out to the perinatal team, and they came round to do an assessment with me. Actually, I just want to mention something before that. I remember the night before I'd considered reaching out to the team. I shut myself in the dining room, which was the only room in the house that hadn't been babied.
Right.
You know what I mean? Like, it was the only room that hadn't changed from before I was pregnant, when I was pregnant, to after I'd given birth to my son. And I just remember sitting in there, closing all the doors and thinking, I just want to go back to my old life. And that was the turning point for me. I was like, I need to get some help. So after I'd reached out to the team, they came to my house to assess me. And I don't remember exactly how the conversation went, but I just remember when they were speaking to me, I felt like the words were somewhere else in the room, and I couldn't really, it was like they were blurred. I couldn't really fully understand what they were asking me. And I felt a bit removed, like I wasn't there. That's how I remember it. And I just thought, and I could see that they looked at me, and I could see that they were worried. And at that point they said, "Look, we think that you need more intensive care than what we can offer you out here in the community at home. I know that we've helped you throughout your pregnancy, but we think that you need a voluntary stay in a mother and baby unit." And I was like, what's that? And they said it's a hospital where mothers and babies go for intensive treatment. They said that we're not detaining you. It's not that we think that you need to go and be detained there, but it would be a voluntary stay. And we encourage women to go before it gets even worse. And I was so frightened. I thought, I don't want to go, because that means that I've got to be on my own with my son, and I don't have the comfort blanket of James to help me. And
was James really worried about you and realising how severe everything was,
James
how you were feeling?
Was just, I don't know how I would have done it with Sarah, the support worker, and with James, because he was there throughout my whole pregnancy taking care of me. So he'd gone from being my newly wedded husband to my carer. He looked after my son for the first 10 days of his life, essentially, whilst I was figuring out that I needed more help. And then after that, he was then being told that his son and his wife would have to go and live somewhere else to get better. I was just so lucky, Rosie, because I had so many people supporting me and looking out for me, and professionally and personally, and I don't think if it was for them that I would have gone to the mother and baby unit, if I'm honest. All the way there I cried because I didn't want to go, but I knew that I had to.
How far was that from your home?
Well, I was really lucky because it was in the town that I lived, but I'm pretty sure that there's only about 5, I might be wrong, mother and baby units across the UK.
And
so
could people come and visit you?
To visit me, yeah. I could have visitors every day.
Yeah.
And my mum and James came to see me every day without fail.
How was that first night? Just
really
I guess
scary.
You two in a room.
So it's mainly just kind of like dorms of mothers and babies. But when you first go to the unit, you can go in your own flat to kind of settle in a bit before you move on to the dorms with the other women. And I cried like the whole night. I was so scared because they said, right, you're going to have your son next to you in the cot, and every time he needs fed, somebody will come in and take him and feed him. And although I couldn't bond with him, I wasn't comfortable with that.
Yeah.
There was a part of me, like an instinctual part of me, that was like, don't take my baby away from me. But then I thought, oh, that's a good sign. That must mean that there's a part of me that wants to connect with him. I was really torn because there was a part of me that really wanted that connection. A part of me was frightened and just wanted to bail. So that was the first night. It was horrendous. And then the next morning they said, right, we're going to move you now onto the ward with the other women. And that terrified me even more because I thought, well, what are they going to be like? I was more thinking, are they going to judge me for coming in here, and rather than what are they going to be like, but a mixture of both.
And were all of those women there, had they all just had their babies and they were all experiencing postnatal depression? Is that?
Most of them were, but with the mother and baby unit that I stayed on, women could go there with their baby up until their baby was 12 months.
Okay.
So, for example, some women might have been admitted when their baby was 6 months, 8 months. And then I think from 12 months, there's another pathway.
Yeah.
I only actually physically stayed there for 10 days.
Okay.
But I was under their care for 6 weeks. So I could have gone back at any point for those 6 weeks if I wanted to. When I was there was a plan, they called it a gradual exposure plan, because they diagnosed me with severe postnatal anxiety and depression.
Okay.
They wanted me to take medication. They encouraged me to take it because they said that it would support me, and I don't have any qualms about taking medication. I know that a lot of women do and have, and I think if that's the right course of treatment for you, then absolutely go for it. When I was pregnant, I was taking a multitude of anti-sickness medications, and I was happy to do that because that helped me. So, but for me personally, I didn't want to do that. I thought I just want to face this.
Yeah.
It's heartbreaking, it's terrifying, but if I don't go through it, like this is me personally and how I deal with things, if I don't face it and go through it, then I'm not going to be able to be the mother that I want to be. So I decided not to take any medication. And it was really hard not to because they said that it would help and it would reduce the anxiety and make the depression maybe a bit more level, but I just felt like that wasn't for me.
No.
Yeah.
So what did you do when you were there? What really helped you?
Actually, being around the mothers really helped. There was like a communal area that you could go into and speak to the other mothers, and being able to speak to them and then say, me too, like I experienced this, you're not alone. That was the thing that helped me the most. Even though I had a lot of professional support in there were nursery nurses who helped me with feeding and like interacting and bonding, and there were mental health nurses to help with like my mental health and that side of things. And then there was like a perinatal psychologist, and she was specialised in providing that further mental health support. There's like for women that are pregnant or have just had a baby. So there was really specialised care that really helped, and just having all of that really intensive support is what I needed. And actually being there and having all of that support gave me the confidence to try the exposure plan and start looking after my son more and more. That was terrifying. I remember they said, right, first night we'll look after him through the night, second night we'll do the same, third night you have to look after him from, I think it was something like 11 p.m. and then it got, it was 4 a.m. and then it got less and less and less until I had to look after him all night on my own. I remember before I went to look after him all night on my own, with a voluntary stay, you can have leave, so you can go home and then go back to the unit if you want to. So I went home for a weekend, and I remember at the end of the weekend, because I'd had a lot of support from James and from my family, I thought, I don't want to go back. So I cried again all the way back to the unit, knowing that I was going to have to do an all night looking after him, all day and all night on my own. I thought, I've got to do it. And that to this date was the hardest thing that I've ever done, is to go back the second time. The first time was hard, but going back the second time, knowing that I had to, and it might sound simple or silly to some people, but if you're going through that trauma, that's like severe anxiety, it's really hard to have to face it, whatever it is, whether it's looking after your child or, you know, a phobia. It was terrifying.
You know, you said your mum and your grandma had the same condition.
Yeah, my cousin as well, actually.
Oh, really?
Yeah.
And did your mum have, was it so severe, and did she also experience postnatal depression, or was that not spoke about as much, or, you know, did she have that?
I think with my mum and my nan, like, you know, it's not spoken about as much as it like mental health, when it's more spoken about now. When they were having children, it probably wasn't spoken about as much, so they may or may not have. But for my mum, I know that she was hospitalised, and my cousin, when they were pregnant.
With the sickness.
With the sickness, they had to have rehydration drips. They lost weight. Unfortunately, I did pull the short straw, and I was sick throughout my pregnancy. But I think there is a high percentage of women, I don't know the correct percentage, that they're not sick throughout the whole pregnancy, even if they have HG. But unfortunately for me, I was, up until the day that I had the cesarean section. I remember, sorry, this is a bit of an explicit, you know, but I was sick over the bath the morning that I was going in for my C-section, and I was so happy, because I was like, this is the last time, hopefully, touch wood.
Oh gosh.
But yeah, it was awful, but I'm really glad that I had the support that I did, both in my pregnancy, from professionals and from family and friends. And then again, afterwards, the support from the mother and baby unit was amazing. And yeah, the support from my friends and family, again, like, people just kept me afloat. And Sarah, the peer support worker that I mentioned, they kept me afloat, and I wouldn't have got through it without them. I really wouldn't. I don't think I would have persevered with the pregnancy. I don't think I've ever said that out loud.
Really?
But I don't think I would have, no, because I just felt so unwell.
Oh, wow. This is really personal.
Yeah.
Has what you've been through kind of changed your decision about having more children? Would you have had more children, or are you scared to have more children?
I would have liked to have had more. Me and James always planned to have 2. But yes, it definitely changed my decision.
Yeah.
Because I didn't want it to jeopardize. I have to say that I have an amazing bond with my son now. He is just the sweetest, most beautiful, like perfect little human, and I love him so much. And I didn't want to potentially put him through that, and obviously James as well.
Yeah.
And there are statistics that if you have HG in your first pregnancy, I think it's something like 80%, that might not be completely correct. There's an 80% chance that you will get it again and it will be worse. And I'm thinking, it can't be more worse than it was. But I do know of women who had HG who ended up being in intensive care in hospital because it was so severe. And I just thought, I don't want that to be me.
No.
I can't put myself through that again mentally. I just want to be physically and mentally well for my family.
Yeah,
and for my son and my husband.
Understandable.
Yeah.
God, it's a lot. I don't think I realised how severe that is. I think people think it is like bad morning sickness, but actually how it's implicated your future as well. And how you feel about having more children. Yeah,
it was a really hard decision because I think we were planning to maybe try again like a year after our son was born, and I had to go through like a grief process, I suppose, of not having another child. I really wanted another child, but I didn't want to go through that again. So yeah, it was a journey, but I feel happy now. I feel content, and obviously I'll always feel sad about it, but I feel like I've been able to process it and accept it now. But it was hard, and it is really sad to talk about and think about still.
For anybody that is going through this, what would your advice be?
Well, as I said earlier, the reason I'm coming on this podcast is because I didn't really share much about it. I felt isolated, I felt shame, I felt like people wouldn't really want to listen, and so I've come on here today to spread awareness about HG, and that it's totally understandable whether you've got HG or not. If you struggle with your mental health or your physical health in pregnancy, there is help out there, amazing help. You can get the support that you need. Even if you feel like you can't speak to those in your personal life, there are professionals that will understand and they will help you.
And we'll put those charities in the show notes.
Yes, thank you.
A question that I ask all the guests at the end is, what is the biggest positive that you can take from what you've been through?
I think the biggest positive is probably that I had more strength and endurance than I actually realised. Even when I was at the lowest of low, I knew that I wanted to get help to change. So I feel proud of myself for that, and just for having the strength to get through it.
You sound like incredibly brave to actually know that you needed the help and to go to the mother and baby unit when you were so scared.
It was terrifying, but I'm so glad I did it, and look where I am now, on a podcast talking about it and feeling proud.
No, you really should be. And I think it's such an important message, because I think, for, like you say, you don't have to have gone through HG.
Yes.
So many new mums struggle, and I think that you don't always want to admit that you're struggling. So
absolutely.
You should just be open. It helps, doesn't it?
It
helps to talk. I'm quite an open book. I share everything.
Me too.
But it really does help. And when you said that it really helped you talking to the other women in the is it clinic?
In the mother and baby
in the mother and baby.
Yes. Yeah.
I can completely relate to that, because it just helps having other people to talk to that are going through exactly what you're going through, when they just get it.
Absolutely. And I was part of an antenatal group. I managed to go to like maybe 2 out of 8 sessions, because I towards the end of my pregnancy with my sick bag in tow. But I I still to this day have this really amazing bond with these group of mothers who all had children the same time as me. And I remember the leader, she encouraged me to share, because I told her that I was struggling with my mental health. She said, why don't you share on your WhatsApp group that you're struggling? And I thought, I can't. But then when I was in the mother and baby unit, I did actually share with them that I was in there and that I was really struggling. And although they weren't also in a mother and baby unit, a lot of the mothers said, I'm also struggling with my mental health. I'm so glad that it's not just me. And then another mother said, me too. And then another mother said it.
So you started the conversation.
I started the conversation. And we're all so close now, and we tell each other everything, and we're really open and support each other, and we do meetups with the children and not with the children. And it's just lovely to have that community of other mothers, as you probably know, because you probably have mothers that you speak to and go, oh, really irritates me, or oh, my children did this amazing thing, or whatever it is.
Oh, that's amazing. Thank you so much for coming on the podcast today and sharing your story, and I'm sure that it's going to really help a lot of people.
I hope so.
Thank you.